Everyone, welcome to my channel. Our today topic is diuretics, in which we discuss introduction, classification, and uses of diuretics. So what is diuretics? Diuretics are also known as water pills. It is a class of medication that promotes diuresis, which is the increased production of urine. Diuretics increase the excretion of water and salts from the body through the kidneys. Now see the general classification of diuretics, which includes acetazolamide, osmotic agents, loop agents, thiazides, aldosterone antagonist, ADH antagonist, adenosine. Let's move towards the site of action of these classes of diuretics. Acetazolamide belongs to carbonic anhydrase inhibitor class of diuretics. It acts on the proximal convoluted tubule of the nephron and stops the reabsorption of sodium bicarbonate. While osmotic agents act on the proximal convoluted tubule, thin descending loop of Henle, and the collecting tubule of nephron, it stops the reabsorption of water. For example, mannitol, isosorbide. Loop agents act on thick ascending loop of Henle of the nephron. It stops the reabsorption of ions like potassium, sodium, chlorine, for example, furosemide, ethacrynic acid, while thiazides act on distal convoluted tubule of nephron. It stops the reabsorption of sodium chloride, for example, chlorothiazide, hydrochlorothiazide. Aldosterone antagonist acts on collecting tubule of the nephron. It counteracts the action of aldosterone hormone and stops the reabsorption of sodium chloride. For example, spironolactone, eplerenone, while ADH antagonist acts on collecting tubule of nephron and counteracts the action of ADH hormone and stops the reabsorption of water. For example, lithium salts, dimeclocycline. Adenosine acts on glomerulus, proximal convoluted tubule, thick ascending loop of Henle, and collecting tubule of nephron. It stops the reabsorption ions, for example, magnesium, hydrogen ion. Diuretics are indicated in the treatment of high blood pressure, heart failure, calcium kidney stones, renal tubular acidosis. Now take a look at the complete classification of diuretics, which are based on their action on the different regions of the nephron. First, those that act on proximal tubule include osmotic diuretics, carbonic anhydrase inhibitors, acidifying salts, xanthine diuretics. Drugs that act on the ascending limb of Henle include loop diuretics, mercurial diuretics. Drugs that act on the distal tubule include thiazide diuretics, sulfonamide diuretics. Drugs that act on the collecting tubule include potassium-sparing diuretics, which include aldosterone diuretics, direct-acting ADH antagonist. Miscellaneous diuretics include alkalizers, for example, citrates, acetates of sodium and potassium. Plasma expanders, for example, dextran, albumin. This is all about diuretics and their classification. Like, share, and comment on the video. Don't forget to subscribe to our channel.